from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. The time now is 6:23, and this morning we told you that almost 100 people have died from the flu in Arkansas. Baptist Health cardiologist Dr. Scott Davis is here with new research about how the flu can affect other systems in your body and increase your chance for a heart attack. Now, this is something that everybody is talking about. You hear it all day, every day about the flu. People are concerned about how deadly it's been this year, and then now this is new research that say not only can you get pneumonia, but it can affect other parts of your body as well.
I mean, justifiably so. I mean, the flu is running rampant this season. It's really had a huge impact in many, many lives. A recent study just got published in the New England Journal of Medicine to add even more to this whole story. One's risk of having a heart attack goes up some 6-fold when you get the flu. Some research came out of Toronto, and they looked at admissions for heart attack in some 360 plus patients, and there was a 6-fold increase in heart attack risk if you got getting the flu within that first week of flu exposure. So again, if we don't beat the drum enough about getting a flu vaccine, this is yet another reason to. So it impacted more folks that got influenza B, folks that were a little bit older. And so we just, it's not in a vacuum just to affect the lungs or affect your respiratory status or your pulmonary status. It can also affect your heart as well. So
there are people out there watching going, okay, what do I need to look for? Because people are afraid of getting sick and not realizing how bad it is.
Right. So again, it's the stuff that comes from the American Heart Association, and it's what we've kind of constantly preached. It's pressure, tightness, heaviness on your chest that just will not go away.
And don't just assume it's the flu.
Correct.
It could be,
That's right. And so it's shortness of breath that is just, you cannot get your wind at all. And so the thing is that in the setting of having the flu, don't assume, right? Oftentimes folks say, well, I don't want to trouble the doctor. I don't want to be a burden. But you know what? Err on the side of going to see the doctor, And here's the other thing. The CDC recommends it's not too late to get your flu vaccine. And so the season can run from October until May. Right. And so CDC says go ahead and it's a universal recommendation now since 2010 to go ahead and get the vaccine from 6 months or older. OK, now we know that the older you are, if you have other comorbidities like lung issues, you're certainly at increased risk for having more complications from the flu. But continue to abide by those recommendations.
The message is take care of yourself and be aware of what can happen.
Absolutely, yep.
Dr. Scott Davis with Baptist Health, thanks so much for being here. Important information as everyone is certainly talking about the flu. If you have any questions, you can always call the Baptist Health Healthline at 1-888-BAPTIST.